Hello, I'm Matthew Trainer. I'm Chief Executive of Oxley's. I'm also a keen runner, and earlier this year I developed some foot pain and it turned into plantar fasciitis, which is a common running injury. I've been receiving treatment from one of our podiatrists, and I thought I'd share a few of the things that I've tried and what I've found helpful. Among the things I've found helpful are this, spiky massage ball, which you roll underneath your foot, and also this, which is a kind of splint that you wear at night, and it keeps your foot at an angle and keeps a pull on your calf. Tell us what plantar fasciitis is.
Yes, so plantar fasciitis is a very common problem. We see about 1 in 10 people get it sometime in their life. It's a problem where we get a strain on the big band of tissue on the bottom of our foot. It acts to hold up our arch, and it's unfortunately sometimes gets a little bit of damage, and we get this persistent pain in our heel.
And I've felt it as a sort of stabbing, biting pain in the sole of my foot, and it started quite mild, but within a couple of months it was too painful to run, and it even made walking quite uncomfortable.
Unfortunately, that's quite common, particularly if you're increasing your activity levels or you've got a slightly higher arch or a slightly lower arch. Sometimes that can predispose you to a problem. If you change your footwear, change your activities, things like that can sometimes help.
And I've been coming to see you for extracorporeal shockwave therapy. Tell us about that.
Yes, so shockwave therapy is a new treatment that we offer. It's really successful at dealing with plantar fasciitis because unfortunately it's quite a persistent problem. We see quite a lot of people have it for several months, and because it hasn't got the best blood supply, the tendon, unfortunately we see that people can have it for a long time before it gets better. So shockwave therapy tends to restart the healing process. It increases, its action is it increases your cells' permeability, so it increases your cells' ability to take in nutrients and heal itself. So on the whole, we tend to find that people respond really well to it, particularly if they had a chronic problem, sometimes over a couple of months. Plus, I've even seen people with 10 years who've had it and it's improved. So it's a really good treatment strategy for us. So I'm just going to begin doing some shockwave treatment on you today, Matthew. So all we're going to do, pop a little bit of gel on there, and then we're just going to select the option here. Lovely. So it does make a bit of a loud noise. Makes this loud noise there. What we're going to do, we're going to pop it on the area that's giving the most pain. So plantar fasciitis often appears in this area of the foot, and often it's due to a strain injury. So often we see a little bit of damage to that plantar fascia tissue, which acts a bit like a big elastic band really to hold up our foot. So sometimes what can happen is that strain takes quite a long time to heal. So using this shockwave machine, it improves the blood flow to the area, improves the healing process. So we'll just begin now, if that's okay. Tell me to stop if you want at any time. Okay. That's completely fine. Okay. How are you doing?
That's fine,
Yeah? All right?
Yeah, absolutely.
I'll do it hard enough. Okay. Lovely. Wonderful. So I'm just going to move it around the area there. Still doing okay?
Yeah, fine, yeah. And the counter, it's 2,000 reps, isn't it, or something like that?
It's 2,000 is our standard. And so we'd often do this 3 treatments in a row. So we begin doing the first one. They can't be too far apart in between these treatments, so we begin and then have them at no more than 2 weeks in between. Lovely. And then we want to leave it, after we've done a shockwave treatment, we want to leave it a little bit of time just to see how you respond. And
so I've had a couple of goes now, and what I found is for the day or two afterwards it's quite sore, and as you said, use paracetamol, not ibuprofen. But then what I've noticed is after that 48 hours there's been a really marked improvement in the amount of pain I felt, both on waking, and then I've had entire days now where I've not felt the foot pain, which is the first time in 3 months I think that I've felt like that. So.
Also, you can use zinc oxide tape. Oh, there we go. Brilliant. All sorted. You dealt with that very well. That's marvellous. Wonderful.
And I've now had 3 sessions with you. Is 3 the typical number of sessions you have with
someone?
We
tend to begin with 3, and then we see how a patient responds. We want to leave it a little bit of time to allow that healing process to fully work. And then we will have a review. If things haven't fully got better, or you've seen a marked improvement, but you want to try a little bit more, then we can always do another set 3. Some people have a couple of sessions before they get full relief.
And also during this, you've emphasised the importance of good stretching as well for the calves and for the foot.
Yes, definitely. That's really important. Sometimes plantar fasciitis can be due to muscle weakness. Sometimes it can be due to a little bit of tightness in the calf. Often with sporty people like yourself, Matthew, we tend to see a lot of people with tightness in the calf causing plantar fasciitis. So very important to keep doing your calf stretches.
And I think that's part of the problem with runners, particularly around my age. You know, you've got 40 minutes to exercise, you go out, you run, you don't stretch. And I think I'm paying the price for that now.
Oh dear. Oh, well, you're a busy man, but you know. But yeah, if you're able to continue doing stretches as much as possible, that'd be great.
All right, thank you very much, Sophie.
Thank you so much. You've been a wonderful patient. Thank you.
Cheers.
Cheers.
I've had 3 sessions of shockwave therapy with Sophie now, and I've noticed a marked improvement in the pain in my foot, both on waking and during the day. to the point where since the third session I've had some days where I've been almost entirely pain-free. So with any luck, I'll be back out running again soon. If you want to find more information about this treatment, then have a look on our website.